Well, good morning, everybody. We are at Sisters Hospital on Main Street in North Buffalo today. Of course, you know Sisters is part of Catholic Health. And this morning, I'm with Dr. Paul Anine and Dr. Roger Walcott. Both are vascular surgeons. We're going to be talking about carotid artery disease and a brand new procedure that I certainly hope they call it the TCAR procedure, because that's what it looks like and that's what I'm calling it. Dr. Anine, I'm going to start with you. What is carotid artery disease and how has it been traditionally treated?
Well, carotid disease is a blockage in the main artery in the neck, which is a leading cause of stroke in the United States. Traditionally, we make an incision in the neck under anesthesia and to remove the blockage to prevent people from having a stroke. With this is a newer procedure that we make a micro incision in the neck and can go in with a stent, which decreases the risk of a stroke both from the endarterectomy point of view and from traditional stenting.
Well, can you give us a little more detailed explanation of this TCAR procedure, or TCAR, whatever you want to call it?
Yes, the TCAR procedure involves a small incision just above your clavicle bone here. The patients can be awake while you do it. You go in through a needle into the artery, and then this device over here is inserted into the carotid artery, and it allows the blood to funnel through this filter system. We can put it on high pressure so it acts as a vacuum, and then the blood, after it gets filtered through, goes back into the bloodstream through a vein in the leg, and it prevents any little pieces from going into the brain causing a stroke while you're doing the procedure.
Wow. How does a person, or how does a doctor know if someone has this buildup of plaque in the artery?
Well, usually one is the patients can be having symptoms of a stroke or mini stroke, but many times their family doctor or primary care doctor are able to listen with a stethoscope, hear a noise, or a carotid Doppler will pick up that the patients have a blockage.
Okay. Dr. Walcott, I wanted to ask you about describing the process that maybe a patient goes through for being a candidate for this surgery.
You know, the patients that we're selecting for this procedure are those folks who may do better with this than a regular endarterectomy, which is the more standard procedure. So they may be elderly, it may be a revision or a secondary surgery for them, and they may have other medical problems that make it better for them to have this. Sometimes it can be done under local anesthesia, as opposed to general anesthesia, so they don't have to go all the way.
They're awake, possibly.
They can be in some cases, yes. So those are some of the factors that we're looking at.
How long is a patient typically in the hospital with a procedure like this, and sort of describe the recovery process, and then how many follow-up visits would it require?
The typical hospitalization is 24 hours. They come in, they have the procedure, and assuming they do well, they go home the next day in the afternoon, for example. And we'll follow them regularly, as we do many of our patients. We'll see them on a semi-annual basis to make sure that no further disease is accumulating in the artery.
But there's really nothing they have to do or be aware of when they go home after that 24-hour period?
Sure, we put them on a couple of blood thinners, antiplatelet medications that they'll be taking that may be new to them. In some cases they're not, but in some cases they are. So we'll follow them for that, but nothing new per se, no.
Okay. Then what would be long-term care or effect for a patient after a procedure like this?
Long-term, there won't be any noticeable effects for them. What we've achieved by putting that stent in is we're lowering their risk of stroke in the long term, so they benefit from that.
Well, I guess really what I meant was, what is life like for the person after the surgery?
Just as it was before the surgery. There's no change in their lifestyle due to the surgery at all.
Perhaps a little more peace of mind, maybe?
Well, in the sense that they don't have this disease process that's putting them at risk for a stroke, certainly yes, more peace of mind.
Dr. Anine, how long has the TCAR procedure been with us? Is this something relatively new in the medical field?
Well, the TCAR procedure is very new. We're one of 30 centers across the country that is in the en route trial, or en route 2 trial, for this new procedure. And it is approved, and it is paid by insurance if you're enrolled in the study. So we're very happy to be one of the 30 centers in the country.
That kind of stole my thunder. I was going to ask in the insurance role in a procedure like this if it was covered.
Yeah, it is covered if you're part of the study, and it's covered by all insurance carriers that way.
Boy, something like this makes us just that much more proud for living in Western New York, and especially telling us we're only one of 30 across the country doing this procedure. That's incredible. Doctors, I know you're busy. I want to thank you for taking time out of your day to be with us, and I hope we've addressed this for anybody in our viewing audience that may be in danger of this disease, and now they know where to come and what to do.
Right. Thank you for having us.
All right,
Appreciate it.
Dr. Walcott, thank you.
Great, thanks very much.
All right, folks, we'll make all the information you need to contact Catholic Health and Sisters Hospital available on screen, so please pay attention as we go to break.